In general, most patients experience far less pain than they had anticipated following their surgery. But remember, this is a surgical procedure, and some discomfort following surgery is always to be expected. A powerful pain medication is normally prescribed following surgery to help keep the pain level to a minimum. It is also important to note that everyone's response to pain is different, and a given procedure which causes minimal discomfort in one patient can cause considerable pain in another. In most cases, patients will require the prescription pain medicine for not only the day of surgery, but usually through the next day following surgery. After that point, most patients are able to switch to the over-the-counter medications, such as Tylenol or Advil, or discontinue the pain medications entirely. It is also important to note that these prescription pain medicines can be irritating to the stomach, so it is usually recommended that the pain medications not be taken on an empty stomach. This again depends upon the patient and the difficulty level of the procedure. Many of our patients are able to return to work or school the day after surgery, but it's probably wise to schedule the next day off as well, in case you need the time to recover. For people who don't have to work weekends, scheduling the procedure later in the week is often preferred so that they can recuperate over the weekend. Swelling is, of course, another concern of our patients, and we occasionally hear reports of excessive swelling following wisdom tooth surgery. Swelling is the body's normal response to inflammation, and a vigorous inflammatory response is to be expected following a surgery such as this. Despite this, we find that most of our patients experience fairly minimal swelling following their surgery. There are several reasons for this. The first is judicious surgical technique performed by an experienced surgeon. Most oral surgeons remove wisdom teeth every day and can perform the procedure with a minimal amount of trauma to the tissues. Another factor that helps keep the swelling to a minimum is ice packs to the face. Ice helps keep the swelling down for the first 12 to 24 hours. After this time, the effect is minimal, but as it is often helpful with the pain, it's perfectly okay to continue to use the ice packs if desired. A third factor that can help reduce the amount of swelling is medication. There are medications that can be used to slow down the body's inflammatory response, which consequently will decrease the amount of swelling following surgery. These medicines are often steroid medicines, but not the same kind of steroids that people associate with athletics. These are steroids that are similar to cortisone, which is a steroid medicine that almost everyone is familiar with. An inflammatory condition of the skin, such as a rash, is often treated with cortisone cream to decrease the inflammation and make the rash disappear. These medications act in a similar fashion, to reduce the body's inflammatory response and consequently to decrease the amount of swelling following surgery. Your surgeon will determine if these medications are appropriate or necessary for your particular surgery. As with most surgical procedures, stitches are usually required. Your surgeon will be able to tell you if your surgery will require the type of sutures that are self-dissolving or the kind which will need to be removed. We have certainly presented a considerable amount of information about the indications, procedures, and potential complications involved with the removal of wisdom teeth. This is normally a very routine procedure, and most of our patients do much better following surgery than they had expected. We realize that most people facing a surgical procedure such as this are quite nervous and apprehensive. This is a normal human response, and your surgeon will make every effort to make the whole experience as smooth and minimally unpleasant as possible. Thank you for your attention, and if you have any questions or concerns about your surgery or anything you've seen on this video, your surgeon will be happy to discuss these with you.